Once you've taken your seats, I want us all to just put our hands on our laps really quickly. Take a deep breath in and breathe out through your mouth. That was mostly for me, but thank you for participating in that relaxing activity. My name is Melanie Santos. I am going to be your moderator today. That breath was for me because I struggle with clinical depression and chronic anxiety on a daily basis. So if you see me a little jittery, that's my chronic illness, my invisible but not so invisible chronic illness. I have brought some cards up here with me so that I can focus on everything other than that. Who resonates with that at all? Anybody have anxiety? Yeah, anxiety crew. Depression. Yes, we are not alone here. I am the entrepreneur, wellpreneur, creator, artist, speaker behind MelanieSantos.co, which is a personal development brand, which really takes on difficult topics and tries to create safe space to have difficult conversations behind, break the barriers surrounding mental, physical, and spiritual wellness. 12 years ago was when I first experienced my first anxiety attack. And I didn't know what it was because I'm Latina, and Latinos don't talk about mental health. Yeah, I see some hands in the back. Latinos don't talk about mental health, as do most people, but especially my Caribbean community. So I've really had to learn to cope and heal on my own, and being the creator that I've always been, I took to the internet. I'm a 90s kid. So I took to the internet, I created my first blog on Tumblr. Who remembers Tumblr? And I started talking about my anxiety attacks and my depression. And lucky enough for me, I encountered so many other people who were going through the same things and who were trying to advocate for themselves in their families, in their communities, and were trying to find ways to heal and people to resonate with. That has grown into my business. I'm a full-time entrepreneur now. Next month, I celebrate my first year as an entrepreneur, which is amazing. Thank you. So this is amazing. I have a whole career in healthcare. I worked in marketing and communications for healthcare for 8+ years, and I left to do what I'm doing. And I actually used to use Healthline a lot. So this is very full circle for me. I'm very excited to be here. Speaking Your Truth at the Doctor and Beyond is the perfect panel for me because of my long history of healthcare marketing and communications, but also because of what I have, not what I am. What I have, and really my last encounter with advocating for myself in the doctor's office was 2 years ago, when I gave birth to my beautiful daughter, and I had to advocate for my postpartum anxiety in the doctor's office. And because I already thrive with anxiety, my doctor didn't really believe me. So I had to really push, and it's taken 2 years to find a physician that, one, listens to me, but two, that I feel comfortable voicing myself with. So I'm really excited to be here with my amazing panelists. Can we give it up for Nitika, and can we give it up for Healthline real quick? Chronicon is like massive. This is like beyond my teenage dreams. I chose to own my story, as all of us have. If you're here, you're already owning your story, and that makes me so happy. I chose to own my story, and I said, if I were ever going to do this full time, which I am, I wanted to just be who I needed when I was younger, and this is like beyond. So shout out to you, and shout out to everybody at Healthline. I want to kick off by asking my panelists to give us a brief introduction of who you are, what you do, and a little bit about your health journey or your connection to the medical field. Let's start with you.
Hello, everyone. Oh, this is so exciting. First off, thank you to Healthline and Nitika. I'm like super excited to be here. My name is April Christina. I started my menstrual cycle when I was 9 years old. I was in the 3rd grade, did not even know that having a menstrual cycle at 9 was a thing. Like, I thought you can just like play in the playground with your friends, volleyball, dodgeball, like that type of stuff in my life drastically changed when I had to have a fanny pack in the 3rd grade and have to have a doctor's note letting them know like this is something that your student actually have to go to the bathroom on a consistent basis because they have to change their sanitary pads. But I didn't think anything of it because my dad is an identical twin, And all of my cousins, of which my uncle had 3 girls, they all started their cycle when they was 10, 11, and 12. So me starting at 9 wasn't far-fetched. It's just that I won the gold badge of being the first one before them. As time went on, as I became a teenager, my cramps became extremely bad. Over-the-counter medication was not working. My pediatrician then gave me a referral to a pediatric OBGYN, and at 15 years old, I was on oral contraceptives. Still, was completely a virgin, didn't know anything about taking oral contraceptives at all. I just knew that it was going to control my menstrual cycle. A few years passed and I started getting breakthrough bleeding. From 15 until I was 26, I had about 6 or 7 different oral contraceptives until I realized that something was wrong. So a little history of my background is I have a Bachelor's of Science in Clinical Laboratory Science, and I also have a minor in psychology. So I've been in the health field on the other side of it for 13 years. But when I finished my rotations and then I became in my late 20s, I started realizing that there was something wrong. So one of my patients was an OBGYN, and I was just explaining to her my whole entire story. Mind you, I was still going to the doctor all the time because now I didn't have cramps anymore. I started having pain in my legs, and they kept thinking that I had blood clots. So I'm going every single time for Dopplers every 3 months for them to make sure that I didn't have blood clots. So when I spoke to my patient, she was like, "Oh, you have endometriosis." 1, I never heard of it before. 2, I didn't even know how to spell it. 3, I didn't even know that it existed. So when I started looking everything up, I was like, oh my gosh, like this is a real serious condition. And this whole time, from 9 years old until I was 27, I had no clue that all the time that I was having breakthrough bleeding, every single time that I had these menstrual cramps and pain in my legs, it was from me having endometriosis. So I had my first surgery at 27, had breakthrough bleeding again 10 months after my surgery, and then I was back having surgery again that following year. So I had 2 surgeries within 13 months of each other. And it was in that moment that I had an aha moment with myself, and I'm like, I cannot be the only one that's going through this. There has to be someone else. So I originally started my first platform called Endo in Me because I just wanted people to understand that having endometriosis is not only yourself, but there can be other things that encompasses it. But then I also started realizing that it's the whole total picture of your body. And then I just rebranded myself, and now I'm April Christina. And my main goal is to spread endometriosis advocacy all around the world to pretty much everyone that can listen to me. And also show that you can also have other sides. I'm a natural hair model. I also do makeup. So I never wanted to take away from what I love, but I also wanted to be true to myself and also share my truth as it pertains to endometriosis and how I went undiagnosed for so long.
Thank you so much for that. Amazing. If you don't follow her, you need to. Amy?
Hi. First of all, thank you to Healthline and Nikita for letting me come today and talk about my story. I, too, have false eyelashes on today, and I'm trying really hard not to cry. That song was amazing. So I'm going to try not to cry, but I might, and my lash might come down my cheek or something.
Crying is good.
But
Crying
I feel
is good.
pretty safe in this room, which is really hard in the industry I'm in. I was one of the first cauliflower pizza crusts in the market. If you haven't heard about cauliflower, I don't know where you've been, because it's everywhere now. There's like 50 of us out there. Anyways, my story goes way before cauliflower foods. I was 40 years old, and I developed a pulmonary embolism. So you had blood clot issues. And the ER doctor, no judgment here now, sent me home with pleurisy. And they called me back when they looked at my scans and said, no, you have a pulmonary embolism. Don't move. How do you not move? And get back into the hospital. How do you not move and get back to the hospital? No. So my husband called an ambulance. I went to the hospital. They quickly put me on Coumadin, which is rat poison, by the way. And then they started looking for clotting disorders. Well, long story short, hopefully, I ended up being diagnosed with mixed connective tissue disorder. And so they weren't sure exactly what was wrong. And I actually have lupus and Sjogren's, which today I'm having a little Sjogren's attack, but I feel really comfortable telling you all that. So I may have to drink out of the water bottle in a minute or two. Another reason why I have eyelashes, because I can't wear mascara. But lupus and Sjogren's. So I'm 40 years old. I'm a stay-at-home mom of 3 kids. I have, they're little at that time. We used to do all kinds of fun things like family fun night, pizza, and games. And I realized the pizza Saturday morning, I wasn't even able to get out of bed. And it kind of happened overnight. And so I'm not sure what triggered it, because I probably had symptoms, and they're still learning a lot about lupus. I now know that my grandmother passed away from autoimmune because it wasn't treated properly, but they didn't know what it was. So anyways, I was put on Plaquenil, and I was put on Coumadin, and I was going to the Coumadin clinic 2 to 3 times a week, trying to get my INR between 2 and 3, which they couldn't do. And Plaquenil is for the lupus, and it has some terrible side effects. So I really struggled with that, because then I was seeing the eye doctor, and blindness is one of the side effects. So it's like, do I want to be bedridden, in bed, in pain, swollen, on steroids, can't sleep? By the way, they use sleep deprivation in prisons for a reason. It makes you crazy. So the steroids were making me crazy. So then I was put on Wellbutrin for the craziness. But the rock bottom was, my youngest was 2 years old, and I could not take care of him, because now they're worried about a DVT, I'm on a scooter. It goes really deep from there, but I start going through early menopause, and I can't take care of my youngest. I can't even pick him up because I'm physically just unable to. So he goes to live with my in-laws clear across the country. And I've hit my rock bottom, because if any of you are moms in here and you can't take care of your own child, that's rock bottom. And I'm married, and by the way, my husband's a physician. I love him, and I've been married for 22 years. But for a long time, I was like, I feel bad. And I had rashes, and I have scars where the rashes are, and he was treating me with steroids for poison oak. He's like, you're getting poison oak with the dogs. Well, I would get rashes on my breasts, and I'm like, I am not rubbing against the dogs with my boobs. So what's happening? Anyways, I ended up deciding that I was going to take matters into my own hands. And this is where I think frustration hits sometimes for doctors, and you can speak on this, is where patients immediately get diagnosed with something and they go straight to the internet. And the internet makes you feel, I don't know, for me, it made me feel like I was 10 times sicker than I probably was. So then I became a victim. And after I got out of the victim mentality of being basically in bed for 9 months, very, very depressed, gained a ton of weight, I decided to take my health into my own hands, and I met with a best-selling book author named Rob Wolf, and he was writing about paleo. And he told me to do the elimination diet. And I quickly realized when I eliminated sugar, caffeine, alcohol, by the way, you're probably thinking, oh, this sounds really miserable, and grains and dairy, I slowly started adding things back, and boom, it was the grains that I realized were causing me so many problems. So I wanted to bring some normalcy back. When Grant came home from living with my in-laws, I decided I was going to go to the internet and look at ways to make our family fun night come back alive again. So I found a cauliflower pizza crust. By the way, I hated cauliflower, never bought it. It wasn't a vegetable I had in my house because I'm a broccoli and zucchini girl, but now I'm a cauliflower girl. And so I started making cauliflower pizzas. Anybody ever tried to make cauliflower pizza from scratch? Straight up mess. It was a mess everywhere. And by probably the 20th time, I had nailed it. But the one thing is, I also had a really picky eater, and he ate it, and he loved it. So I was like, okay, I'm on to something. So that's how my business started. And yeah, that's how my story started.
Yeah, amazing.
I
What an
do
amazing
believe
journey.
food is medicine. I do believe that. But it goes deeper than just food. You have to be stress-free. You have to get good sleep. Sleep is like really powerful.
Absolutely. Dr. Tay?
Hi, my name is Dr. Tay Ahmed. I work as a pelvic pain physiatrist. How many people have a physiatrist or know what a physiatrist is? What about the rest of you guys? No? So this is a lot of the problem I feel like as a physiatrist, as a physician. Some of my physician friends don't know what physiatry is. And it's completely true. I'm not even kidding. A lot of my colleagues are like, physiatrist, are you a psychiatrist? Do you treat feet? Are you a podiatrist? Are you a physical therapist? What do you do? And no offense to anyone, it's just we have our own field. We treat rehabilitation. So every single field of medicine should have a rehab department after. So if someone goes into the hospital, has a stroke, they see the neurologist. After the neurologist, they should go to a rehab department to treat the patient post. Similarly, with pediatric injuries, a lot of kids end up having to go to a peds rehab department. A lot of these things no one knew. I had no idea about this field until I basically was at my end of medical school, and a friend of mine was like, why don't you apply for physiatry? I had no idea what I wanted to do. I was trying to decide between pediatrics and anesthesiology, and I did the rotation at NYU Rusk, fell in love with it, absolutely loved seeing what happened to the patients after they were inpatient at the hospital. And after doing that for a little bit, I was doing sports medicine. I kind of fell into the field of pelvic physiatry. And now I treat chronic pelvic pain. I'm sorry. I treat chronic pelvic pain in Manhattan. I see a lot of women and men with invisible illnesses. They don't have people who believe them. They feel like they're constantly told that there's nothing wrong with you and everything's normal, but they have this odd sensation or feeling or pain in their pelvis. And every day I go to work and I sit with my patients who are in chronic pain or sometimes acute, sometimes they'll come in, but it takes about a year for a patient to find a physiatrist, unfortunately. Sometimes I treat women with painful periods, endometriosis, which takes 7 to 10 years for diagnosis. Men who have chronic prostatitis, which they'll go to ER all the time with these infections that don't actually exist, and they're treated with antibiotics unnecessarily. And so I kind of am on both sides of the story because I feel for my patients, and I know that there are doctors who are trying to help, who don't know about this field and don't know that there is more to do.
Amazing. Thank you, Dr. Tay. Dr. Darien?
I love coming to this because I learned so much. My name is Dr. Darien Sutton Ramsey. I'm an acute care emergency medicine physician here in New York City. I also trained at NYU. For me, coming to Chronicon was something that started very early on, and why I got into medicine in the first place. I am the son of a mother who is a nurse. She's retired now, but she has 8 sisters, all of whom had various medical conditions that unfortunately led them to an emergency room at one point in their life. And being the son of this mother, all of these women were my aunts and really honestly my mom. So I also ended up in emergency rooms. And it was at that time in my life really early on when I saw what an ER was, and I realized that there was no one that really looked like me there. And I felt like my aunts weren't being listened to. And so it was kind of the inspiring moment that led to my education and my training to try to be that voice of reason in the ER, but also that perspective that may not come from the normalcy that exists in medicine. I got to Chronicon, obviously, for many different reasons, but I think most of which is the way that I communicate with patients, but also the way that I share the way that doctors think about a differential diagnosis or a collection of ideas that they think may be attributing to what the symptoms are. I share them on Instagram in this thing that I do called Bus Stop Med, which is basically me at the bus stop being awkward, taking photos of things, but also talking about a diagnosis that I found interesting from the day and explaining how my thought process led to that diagnosis. Now, when I sit on this stage and I listen to the diagnosis of something like pleurisy with the unfortunate wrong diagnosis and real diagnosis of a pulmonary embolism, I will admit that it will make me go to work tomorrow and sit and really listen. And I think that that's the key to what is missing in medicine, is listening, but also something that we've never learned, which is communication. So I'm really happy to be here, and honestly, I'm really just here to learn more than anything. Nice to meet you guys.
Round of applause for our amazing panelists. I want to dive in with April and Amy first. What has been your relationship with going to the doctor in regards to your health journey, and was there a point where it changed?
I'll go first. Well, for me, before I was initially diagnosed with endometriosis, they kept thinking that I had blood clots in my legs. I absolutely never had blood clots in my legs. So that was one indication where I could not go to my pediatric GYN anymore. And then the GYN that I had, when they did do a sonogram, they did see cysts, they did see fibroids. However, because I'm a woman of color, it was said to me, well, most African-American women already suffer from cysts and fibroids. So, just keep coming back for it to be monitored to see if it gets bigger or if it shrinks. Obviously, it did not go anywhere, so that's when I had my first surgery, which was an ablation surgery. I'm not sure if people are familiar with, okay, you shaking your heads. Okay, so my first surgery was an ablation surgery, and then to go back to what I initially said, 10 months later, I had breakthrough bleeding again. That was my aha moment for me to do my own research, and then I realized that the surgery that I had did absolutely nothing for my endometriosis. It just touched the surface of it and did not actually go in depth. So my mom went to Google and was like looking all over the place for the right physician, and she found one here in New York City. And I was like, listen, I have nothing to lose. This will now be my third doctor. This will be my second physician that I'm going to post my ablation to see what can be done. And when he did the 3D sonogram, he was like, you are completely messed up and you need surgery immediately. So obviously I trusted him because he gave me a list of do's and don'ts, supplements to take, food to avoid that will cause flares. And at the time, I didn't even know that there was such a thing called endometriosis flares, where your abdominal area swells up and it makes you look as if you're pregnant. I had no clue. Although I was already experiencing that, I thought I just ate something bad because my stomach didn't agree with it, not knowing that medically it actually led to something way deeper as it pertained to my condition. So he immediately became my physician. He still is my physician. To this day, it has been 7 years since I've had my excision surgery. I do thank God as well as him for actually saving my life and for preserving my female organs, and to be able to actually see past what the other people didn't see, because my surgery was 7 hours long. And when he did the surgery, we found out that my endometriosis had actually spread to my bowels. And I had no clue. I was still having regular bowel movements. I was still urinating as if everything was normal. But to have a physician to go that extra mile and step and say, hey, we're going to have a cardiologist in here. We're going to have a GI doctor in here, because I don't know what I am going to expect, but I'd rather be prepared than to not, just in case if something happens. So I was extremely thankful, because he had to have another physician there that specializes in removing the endometrial tissue from my bowel. So I absolutely, I changed physicians probably 3 times before I finally felt comfortable with the person that I have now. And I went from 3-month follow-ups to 6-month follow-ups. To date now, I'm at yearly follow-ups.
Incredible. I want to say thank you for sharing that, mostly because on my platforms I talk about therapy a lot, and I advocate for therapy, but I talk about dating your therapist and date around until you find a doctor that you can really, communicate and are comfortable with. I also want to say thank you for touching on your experience as a woman of color, because we're so often, as women in general, we're just told, hey, this is what you have and this is what you have to deal with. But Black and brown women, like, this is what you have. You really have to deal with it. There's no way, for us to help you. Amy, can you please share a little bit about your journey?
Yeah, so autoimmune is tricky because you have to have active symptoms and positive blood work in order to actually truly be diagnosed with it. And the tricky thing is, you can have positive blood work and no symptoms, and you don't have it. Or you can have symptoms, and this is what was happening to me, and have a false Well, I had a false negative, but you can also have a false positive. So it was a little tricky. So at first, when I was getting treated with steroids, which masked the problem, this is before the blood clot, basically the rashes would go away. So because the steroids did that. So I truly believed that I had poison oak. It was just where the rashes were didn't make any sense, even if the dogs were tracking it in. So finding a physician, and really, I surrounded myself with people that I decided food was going to be medicine, and I was going to change the way I was going to eat because I could really tell the grains were causing a problem when I did the elimination diet and added foods back in. So I surrounded myself with physicians that understood inflammation and the causes of inflammation. I also now try to practice a lot of stress relief, and I know you're gonna probably ask about that later, so I'll talk about that later, but I think stress and lack of sleep for me, causes a flare-up just as much as what I put inside my body. So it's really important for me to take care of myself, but also find the people, the support system that really understands autoimmune. And somebody on the previous panel had talked about, because I had to do this, talked about their friends not accepting them. And I remember, in my 40s, our kids were all toddlers, and there was a group of us, and we started having parties again with our kids, though. They would put them to bed, and we would have dinner parties. And often I couldn't go to them because I wasn't feeling good, but I didn't quite understand what was going on. And one of them said, "You're just antisocial. You've got antisocial anxiety." And so I thought I had anxiety, and I was antisocial. And sometimes you've got to detox from those people. You have to just eliminate them from your life because they're not going to accept you because you don't look sick. So sometimes you've just got to surround yourself with the people that are going to love you unconditionally no matter what. And I lean a lot into my faith, and I'll talk about that in gratitude. My mindset really makes a big difference for me.
I love that, Amy. And I also love that you mentioned targeting a doctor that dealt with one specific thing versus just looking for a doctor that dealt with all the symptoms that you were going through. I want to ask you guys, how do you recognize when your doctor isn't understanding you? This is something I know all too well, unfortunately. And what does it feel like?
Well, for me, it was definitely an isolation because to be a woman of color, there's already a statistic about, okay, well, you only have cysts and fibroids, like, you're okay. When I know that there's something that I'm actually not. But also, I think it is okay to actually have dialogue and have a professional conversation with the person that is actually your physician. Because at the end of the day, just like we're talking, or just like you have friends and you have family members, you have to have that connection with your physician just as much as someone else on the street that you've known for a long time. Because although they do study medicine, you live with your body every single day, and you know exactly how you feel on a daily basis. And especially for me, because once I got into my 20s, I didn't have the classic symptoms of what endometriosis looked like. And I couldn't fault the physician for where he was in his practice and what he understood, because he knew, okay, you have heavy menstrual bleeding and you have bad cramps. But there's also something when you have a condition as endometriosis for so long and it goes undiagnosed, that those tissues actually go on different nerves and different neurons. And that's the reason why I experienced leg pain so much, because my endometrial tissue actually went on the nerves of my legs. And that's why I had leg pain. But it wasn't until I had the physician that I have now where I asked those questions, and I was like, hey, well, why do I have this leg pain? And he actually sat down and had a conversation with me. And also being on the other end of it as a healthcare professional, it is sometimes kind of hard to actually identify and be able to speak one-on-one with your patient, because you are thinking about the rest of your day and what other patients you have. So I think it's better when you actually go in and can actually have a motive and a focus and target points of what specifically you want to say. And once you have that question, then have A, B, and C, because you don't know how the conversation is going to go. But if you already set the narrative of how you want it to go, then you will have those other points where you can be like, hey, doctor so-and-so, well, I understand that you said A, B, and C, but I also feel D, E, and F. What do you think I should do about that? Or what do you think my next steps should be? So I think actually having that dialogue and starting a conversation, and even when you hear something in your mind that actually alerts you and you're like, hey, but my body doesn't function that way, don't actually sit there. It's not challenging the physician, but it's actually having that specific conversation to be like, hey, I understand that you said this, but my body is exemplifying that, and see where the conversation goes from there.
We're gonna touch on what you can bring with you, types of skills and topics of conversation you can bring with you to the doctor's office in a little bit, so stick around. Amy?
Yeah, so autoimmune is tricky, like I said before. So the doctors knew what they were doing. They put me on Plaquenil and steroids, and that's what treats it. But sometimes the treatment of the disease or illness or lifestyle, whatever it is that you're treating, sometimes the treatment is worse than the actual disease. And that's how I felt. I felt worse after I was on the meds. Of course, I had to be on Coumadin because I had a blood clot. I had to be on Lovenox, giving myself shots because of the blood clot at first. Then they removed the enoxaparin. But the Plaquenil was horrible, and so was the Coumadin, the rat poison, I call it. So it was a matter of taking it into my own hands. The thing that I learned just from marrying my husband is that, and maybe it's changed because, I mean, we're in our, I'm almost 50 and he's in his 50s, but they had all of about 15 minutes on nutrition. They didn't get any kind of education on nutrition. So my new physician, who specializes in inflammation, she's well-versed in nutrition and what triggers inflammation. And I really think, having my business, we worked with some co-packers in Italy, and when I went to Italy, I learned that I didn't have triggers there. I didn't get inflammation. The food is so different there. So for me, coming from the food space, it's my mission to change what is allowed in our food. You really need to become your own advocate and read your labels. Read what you eat, because in the United States we put, and I'm not going to go on my soapbox because I will. I'm starting it. I can feel it. It's horrible, the fillers and the things that they put in our food. So eat clean. Anyways, I'm going to stop there because I will just take over.
Thank you for sharing that. Okay. One question was, I want to quickly shift before we shift to Q&A. I want to get some of the doctor's perspective. Can you give us a behind-the-scenes look, really briefly, about what it looks like on your side? Are you set up for success? And do you have the time to really build true connection with your patients? Dr. Tay?
So I am in private practice, and I'm actually very lucky. I only see about 6 to 10 patients a day. I spend about an hour and a half with each patient, which sounds kind of crazy, definitely for you. So sometime, like this past Friday, I was in a room for 2.5 hours, and I didn't even realize, I work right through lunch. I was like, whoa, what were you talking for 2.5 hours? Unfortunately, not every doctor has that luxury. So I feel like I'm set up for success because my patients have the opportunity to talk about whatever is going on with them. We go on, I let them tell me their history. I ask them a whole bunch of questions that they may have not asked me, which is key. We'll talk a little bit about their family history and what could have caused things. We'll talk about if I feel like there might be a immune response going on or something that could be behind the scenes that they may not have thought about, or like a systemic condition. We can talk about all that in like an hour, and then I do an exam, and then I do a little education, and then I do a treatment plan. But not every doctor can do that. I think our generation of doctors are now taking to social media and becoming more specialized and more niche because we don't want to be like the older generation. that is a little bit jaded, not that your husband is, that basically is worked to death, seeing 30, 40 patients a day. And I'm here in Manhattan, so imagine what it's like outside of such a big city. So when I have patients who are really, really upset with their feelings and their emotions and the way their pain is, they go to Google. And I tell them, you have to realize that the person sitting on Reddit in middle of America is not necessarily getting the treatment you're getting here. And it's unfortunate. And that's very, very much the reason I went to social media and joined, because I realized there were so many patients who, well, not people who couldn't get access to healthcare. And though none of the doctors on social media can actually give medical advice on social media, we can offer information. And information is key. And information is what, it's basically what brings us that satisfaction that people in Italy and Palestine and Pakistan and India are messaging me and saying, I think I have this condition. I think I might have that. What can I do? And although I can't say, go do this and get that lab work, I can say, go find or follow this hashtag and see if you relate to any of these people. And I'm not even sure what I was supposed to be saying. But
No, you got it. Gave us a perspective of the physician's perspective. My anxiety is trying to get me, guys. Dr. Darien, can you briefly give us a perspective from the ER?
Yeah, sure. I wish I could spend that much time with a patient, but I would say that my day at the ER is very variable because I'm an emergency physician. I'm a teaching physician, so I attend in the emergency room, which means that I work with residents who are physicians who are currently in their training to become emergency physicians and boarded. And I also have medical students, and I also have scribes following me, so I have a lot of things going on, and at most I would say I spend probably 15 to 20 minutes talking to a patient. And that's probably more than average when you speak to an emergency physician. I do certain techniques that I do in the emergency room, which is I always sit down. Number one, I'm tired. Number two, I find that it levels the playing field a little bit in the physical sense. I have to acknowledge myself that I'm a cisgendered man. There's a power dynamic. A lot of my patients who are dealing with chronic issues are usually patients who are female, and so there is already a power dynamic there. It's very intimidating, and so I try to figure out my best way to figure out how to normalize that playing field, but it will never be equal. And then what I do is I ask two simple questions. Number one is why today? I think that that's really important and really, really fruitful in terms of what it produces. And then my second question is, what are you most afraid of? Because when I answer those two questions, I find a sigh of relief usually in the room, and then I also find that patients usually are just more willing to share. My other thing that I would recommend is that if you are on medications, to simply bring a list of those medications. I can often say, so many times I speak to a patient and they may not be aware of their medications, then I have to do my due diligence and find out the pharmacy that they're at, call the pharmacy, and provide the appropriate forms to prove that I'm a physician in order to get those medications, in order to understand what medications that patient has been on and maybe what medications they've been on previously, excuse me. And then the other thing I would say that is really, really helpful is bringing an advocate. I can say so many times in the emergency room when the advocate has helped me save a life. I can think so recently, it was about 2 weeks ago, I had a patient that brought in with chest pain, and he was really much trying to I'm fine. My wife made me come in. And then I met his wife an hour later, who was extremely frustrated that the care wasn't moving fast enough and elaborated on a story that was completely different from the story that he had shared. And he ended up having a specific diagnosis, which is life-threatening, called an aortic dissection, which most people die from before they get to the hospital. And if it wasn't for her being an advocate for this patient, and also I'll never forget the end of the conversation, she goes, also, we're getting a divorce. I don't even like this guy. And then that led to me doing a full workup of this patient that honestly saved his life, in which case I probably would have discharged him. But bringing an advocate, understanding the medications that you're on, and being specific with what you need from the doctor, I think, are the most important tips and tricks I would give to someone.
Thank you both so much for your service. And I love the fact that you guys, the number one thing that you guys do is give patients the safe space to communicate. That's like amazing. I think for the sake of time, we have space for 2 questions. So if you have something burning.
Hi, my name's Molly. I have MS, and I've had several doctors, good experiences and bad experiences. And when I was in rural Vermont, which is where I'm from, I was told I had carpal tunnel. And I was wondering how a patient knows to go to a second, and in my case, a third doctor to get the correct diagnosis. When is the right time to do that?
In my opinion, every time. I have hip pain. I'm gonna go to 3 doctors. And unfortunately for you, because if you don't have someone in medicine in your life, it's really hard for you to be able to bounce back. But when patients tell me they've only gone to 1 doctor and then they never did anything for 20 years, I'm like, wait, really? You have to do it. I mean, you have to go to 2, 3, 4, 5 doctors, and I'm not talking doctor shopping. Like, I'm talking just to make sure, because you have to be like very specific. So if you're going to your pelvic pain doctor and you're talking about your tongue hurting, there's very little I can do for that. You kind of have to take what is your actual condition or issues that you're having that are your priority and go to a doctor for that. And like primary care doctors also are very hard because they can't manage, 8 things at one time in that 1 hour. I would say, can I schedule you for like another visit? Let's just do the 4 topics today or 3 topics today, and I'll come back next week. And because then the doctor won't feel overwhelmed and the doctor can handle it. And then this way you can come out of the visit understanding like, what were the things that I need to do for that situation, getting tested for the carpal tunnel, not just coming with like a diagnosis of clinical correlation, making sure that you actually have the proof that that is my diagnosis.
To add on to that, I would say trust your gut. Because I think a lot of times we take what the physicians say and we're just like, okay, thank you, doctor, which is fine. However, there's something that's in the back of your mind that's just like, wait a minute, but this wasn't specifically touched on, and I'm not sure if this doctor actually understood what I'm saying. There's nothing wrong, and it's not rude and disrespectful to get a second opinion. I think that it would be a disservice to yourself as a patient to not advocate for yourself, to actually find someone else. And I think that we also fail to realize that on top of us having a chronic physical illness, our mental and emotional state also plays and ties with that as well. And if your mental and emotional state with you trusting your gut is saying, hey, I need to have another physician, it is okay, because mental and emotional is half of the battle with helping with your chronic illness and with your healing.
Thank you so much. Another question? You in the green? Hand up. That's you.
Hi, my name is Melanie, and I've had bipolar for 25 years. And so every day I live hour by hour doing all the things I need to do for my health. I go to the doctor, I bring a packet. It's like 6 pages long. Every doctor I have, every procedure, every illness. And medication's really hard on the body. Like you were saying about the steroids, medication's very hard. I've been on medication for about 22 years, and it's rough, and so I have a lot of other illnesses. And recently this summer, we found out that I have a cardiac condition, and I had a defibrillator implanted. I don't know if anybody knows about these, but it's really traumatic, really scary. My doctor didn't really explain what it was. He had me decide which kind to get. After doing the test to find out I had it, got me up from anesthesia, had me make a choice about something I didn't know anything about, and then put me back under to put it in. And the biggest part of the trauma is the ICD is there to prevent cardiac death. That's what it is. And I'm like, I didn't know that was an option. Like, I didn't know that was what was coming. Because every day I deal with the fact that I could kill myself, and that's normal for me. But not being able to do anything, the doctor gave no advice. I could still practically not say the name of the illness. I'm still working on how to physically say it. But I had to go to a dentist, and with a heart condition, you have to have antibiotics before going to the dentist. So I asked my doctor to write it up, and he wrote, Emily is 42 years old, has bipolar disorder, blah, 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 and had this procedure and needs the antibiotics. And I was like, you've got to be kidding me. Bipolar is the first thing that comes up after this heart surgery. And I've told many doctors before, you're treating me as someone with bipolar. You're not treating me as someone who knows my body and my health very well. I am leaving your practice now. And so the heart doctor or the cardiologist, I'm leaving. But like, when do you leave? When do you say this so that people understand? Like, don't do this to the next person. Or when you're in treatment, when do you know, hey, I can make that transition now?
Thank you so much for sharing that story. It almost makes me, I don't know if it's because of this really great lighting that I feel emotional, but it really honestly makes me tearful to know that someone would do something that's so life-changing in a sense and not take the time to explain. And we touched upon this a little bit. How do I know if I should get a second opinion? As a physician, your primary goal is education. And with education, you must have humility. And with that, you must be able to fully and confidently explain something to a patient. That is your only job. And you then need to invite that patient into a team discussion between that patient and yourself to make a plan. And I feel like as a physician, I try to teach this to residents, and that's my goal, especially because in my mind, I'm thinking I'm treating my aunt. And I feel for you, and I don't understand how a physician like that can get so far to be able to do a procedure like that and be successful. But I also realize the reality, which is that communication isn't taught in medical school, as many things are not. And so you touched on so many red flags that you can now educate many people here on. Number one, if you do not understand the diagnosis and the physician is not able to explain it to you, then you need to change that physician. It's as simple as that. I have so many patients that come into the emergency room with stacks of papers and they simply have never been explained what the papers mean. And then number two, it's something that we need to change in medicine. We use primary health conditions and we copy and paste and we put that in the note, not realizing the detriment that that has on the patient during their next hospital visit with a completely different provider. And it's something, sadly, that you just made me help me realize more that we need to actively change, which is these stigmatizing conditions. Unless they are necessary for the diagnosis that we're treating today, we need to not discuss them. I talk about this all the time with my residents, specifically when we're pertaining to well-treated HIV. Patients are in the same risk factors as many other diseases. So we need to stop stigmatizing patients for their conditions that happened prior, especially if they don't have to do with the discussion today. But thank you so much.
Thank you all so much. Are we wrapping up? So I could do the Q&A all day. We're wrapping up? Okay. Thank you guys so much for being here, for listening to us. I hope you took something from this. I want to thank you all so much for contributing your stories and for just, setting in stone that pain is not normal and we don't have to live with it, that, it's great to have communities of people to have support from, but we also need support from our doctors. And chronic care doesn't all look the same. It isn't one size fits all. So thank you all so much. Enjoy the rest of the day.